All right. Hi, everyone. My name is Kim Wood, and I'm a member of the Adult Cystic Fibrosis Advisory Committee, or the ACFAC. On behalf of our entire committee, I would like to welcome you all to the 7th webinar in our educational series on fertility and family planning for people with cystic fibrosis. Cystic Fibrosis Canada's Adult CF Advisory Committee provides perspective and advice on CF-related issues and advocates for public policies and programs to help people with cystic fibrosis. Members also foster and support an engaged and knowledgeable CF community. Among the committee's various initiatives, we are pleased to host this webinar series through which different aspects of fertility and family planning will be discussed by a variety of expert guest speakers, as well as people living with CF that are willing to share their personal experiences. Please note, this is an educational webinar series. CF Canada cannot provide any medical advice. Although the series will feature a few CF clinicians and other health professionals, we do highly recommend that all persons with CF seek guidance from their CF clinic care team regarding their personal family planning process. Today, we will be hearing from Chandra, a counselor from Vancouver, BC, who is very knowledgeable in this field, and Jason Chartrand, an adult with CF that will be sharing his experience with emotional support during infertility and family planning. We will then take questions after hearing from both of our speakers. So Chandra Sen is a registered counseling therapist with a master's degree in counseling psychology from the University of British Columbia. She began working in the field in 1981 and started her private practice in 1988, working primarily with children and families. Since 1999, she has also developed a specialization in the field of infertility and counseling, working closely with various fertility clinics and seeing clients from the Lower Mainland in BC and the States. Her client base includes couples, same-sex partners, single parents-to-be, third-party procedures, and patients coping with loss and grief issues, which are issues normally associated with this population. The investigations and treatments associated with infertility can be enormously stressful for patients involved. In her work with clients, Chandra addresses the impact of infertility as it relates to intervention, treatment, and the outcomes of fertility treatments. Furthermore, her counseling also encompasses educating and familiarizing patients with coping strategies to deal with the often far-reaching implications of and stresses associated with infertility. In addition to her clinical work, she conducts support groups for patients and workshops for practitioners in the areas of infertility and family counseling. I'm so pleased to welcome her, and I'll now pass it over to you, Chandra.
Hi, thank you, Kim, and thank you to CF for asking me to hold this or participate in this webinar. As Kim mentioned, I've worked in several different fields over the last 30 years and see clients dealing with infertility from all of the local clinics here in Vancouver. And today I'm here to talk about sort of the emotional aspects of infertility, how it's experienced by the clients that I work with, the stresses and anxieties that are the companion, sort of a constant companion of anyone going through any kinds of reproductive struggles and undergoing certainly any fertility treatments in an effort to have their family. In the short time that I have with you, I'm going to walk you through a brief overview of how both the condition of infertility as well as the process of treatments are stressful. Then I'm going to list the ways in which the stress presents itself. Then I will talk about sort of the similarities and differences in the ways that men and women might experience infertility, and how those differences in particular might create conflict for the couple who are dealing with the infertility journey. And I will also discuss some coping mechanisms which hopefully will help clients navigate their infertility experience and particularly the treatments as well. I want to talk about why is this topic worth discussion. Mainly it has to do with our expectations versus our reality. You know, going through life, most of us usually give little thought to not being able to have children the normal way. For the most part, growing up, most of us take our fertility for granted, that when we are ready, and that could mean I hear couples talking about getting established in our chosen careers, in the long-term relationship that we want to be in. So when we're ready, we will look at getting pregnant and it'll happen. So in a sense, we often, however, unconsciously believe that this is kind of a biological right that we all have. And so we also assume with that belief that we have control over our decision and the timing of when we want to start a family. So we end up often deferring pregnancy and starting a family. Any of us that have gone through any kind of fertility, if we knew then what we know now, we probably wouldn't have spent time and money on birth control. So we put the thoughts about starting a family on the back burner, trying to prevent unplanned pregnancies in our 20s, which I am in agreement with, but just in terms of how a client dealing with fertility kind of looks back and second guesses their decision, sometimes this often comes up. And in our 20s, we are rightfully concentrating on other much more foundational tasks of life. So when we do feel ready and then run into difficulties getting pregnant, the impact is very often terribly jarring to the psyche. And over the years, I have worked with a number of clients with cystic fibrosis, and in their specific cases, they've had to navigate decisions, of course, regarding their daily issues of health concerns, and on top of that, navigate fertility issues. Though the cystic fibrosis itself was not a direct cause of the infertility, particularly for the women that I recall I've worked with, the medications and the treatments were definitely connected to the need for fertility treatments or the cycles. Of the patients that I can recall, I've been doing this for a long time, so often I don't remember everybody, but I clearly remember two who went on to have successful fertility journeys, but that success preceded making harrowing decisions for themselves and their partners. Each of them or each couple had to make difficult decisions about a third-party cycle, which includes, a donor process or a surrogacy process. The male client and his partner needed to do a donor sperm cycle, and the female client I worked with did a donor egg as well as a surrogacy cycle. And in and of itself, I can spend an hour talking about third party and what the issues involved with third party cycles are. But those techniques bring with them an additional issues that clients have to navigate. Their decision becomes not only about whether to do a specific type of fertility treatment, but on top of that, what and how will they deal with disclosing to their child in the future or other family members and important people in their lives. So there are additional layers that they have had to deal with. So it's not something that necessarily gets easy with time or making one decision about doing fertility treatment. It can be ongoing and the process lasts a long time. So what is the crisis? Crisis, if you take the definition of crisis that was put forth, is any information that drastically and negatively alters a person's view of his or her future. So finding out you're infertile presents more than a stressful life event. Being able to conceive is closely connected to our sense of self, including self-esteem and identity, as well as our sexuality and our body image. So when couples become aware of obstacles with their reproductive abilities, and then after that run into difficulties with diagnosis and delays that are completely or feels completely outside of their control, an emotional crisis occurs. So basically being infertile in what seems to be a fertile society. So they have to deal with the expectations of themselves, their family and friends and social groups. Living in Vancouver, I work with couples from many different cultures and family backgrounds. And I hear the difficulties my clients experience in terms of their own expectations about when they were going to start their families and what that means for them, as well as those from their families or different cultural backgrounds. I very often hear the sadness that comes from not being able to provide grandchildren to their parents, as well as feeling all kinds of emotions, at feeling left behind when siblings or close friends are getting pregnant. And in the sort of eyes of the clients that I'm dealing with, to them, it seems the whole world can get pregnant very easily except for themselves. So they have to navigate all the sadness and sometimes very difficult emotions and thoughts that come up. And then you add in failed cycles, possible pregnancy losses once you start fertility treatment. And then it becomes a little easier to understand that for many of the clients that I'm working with, the entire process of infertility and treatment is neither short nor easy, and that feeling of living in a crisis mode is particularly prolonged and difficult. So infertility basically involves a series of losses. It's a loss of hopes and dreams. What was our life going to look like? What was my life going to look like? What was the family going to look like? Loss of a positive self-image, often associated with my body's not cooperating. Loss of privacy once you start treatments, medical treatments, going to doctors, being poked and prodded. A loss of feeling of connectedness and belonging to your social group, to your age group, to your family group. Kind of nobody understands the fertility issues that you might be going through. And generally a loss of control, especially once a diagnosis of fertility issue is made and then treatment starts. It invades every aspect of the person's or the couple's life, and they are embarking on processes that don't have necessarily any guaranteed outcome. Common feelings that I see, it's not a surprise that most women report anxiety as their constant and very unruly companion while they navigate the roller coaster ride of infertility. The feelings I hear expressed by my clients pretty much covers every human emotion possible, and particularly emotions that are difficult to manage for the people who are experiencing them. Like any life crisis, the first or the initial experience could be defined as a shock to the system. And then once you get into investigations, everything about it feels unfair, uncertain, unexplainable. Clients speak of shock and disbelief at the diagnosis of infertility, and that's if they have a diagnosis. Very often there is no clear diagnosis, which is unexplained infertility is particularly difficult to deal with. Fear and dread once you start treatment, because your life kind of gets taken over by medical appointments, getting tested, poked and prodded, taking your temperature every day, and sometimes it means enduring surgery and all kinds of physically distressing procedures. And the general feeling of helplessness, realizing that no cycle, no surgery comes with a guarantee of success. So once we decide to start procedures, it continues. It's a decision that might be made. And in addition to the physical aspects, there's the managing of getting your hopes up. And then if things don't work out, sort of managing the double-edged sorts of desperately wanting to believe in the cycle's success while working hard not to get too hopeful in case the cycle fails. It's this constant balance of fear and dread and hope. Add to that the very real financial costs of any treatment and the experience of life as unfair while anybody going through it is again kind of relived over and over. As I mentioned before, at its core, infertility is about loss and grief. And one of the biggest losses is that of control, and layered over with loss of hopes and dreams. For dealing with any kind of a crisis, including that of infertility, that initial reaction I talked about of shock and disbelief are often followed by feelings of guilt, shame, isolation, depression, grief, and mourning. Even though both partners are affected emotionally, this is not always in the same way or at the same time. And many of the losses that I speak of that are associated with infertility and treatment are often invisible losses. They're invisible to others. So the experience of the couple or the person going through it is often very lonely and isolated, or a feeling of isolation. But as I mentioned, they're not always feeling the same thing at the same time. So there are similarities and differences between people going through it or a couple. The bulk of the testing, of course, are faced by the woman. And that these feelings of resentment, isolation are common for a woman to feel. Having children is biologically a woman's issue, the physical aspect of it. So much attention is paid to the woman's physical and emotional well-being or status. Testing and treatment are typically faced by the woman, even when there are sperm-related issues. It is the woman who will be going through the actual procedure. So yes, that's why a lot of attention is paid. However, it is when there's a couple involved, they're both going through it. And for many men, it can be difficult to display emotions, especially sort of the vulnerable emotions of sadness and disappointment. Often I see couples where the man takes on or is put in the place of being in the position to support. I'm generalizing a little bit, but we do socialize our boys to be more comfortable to display strength and be the person who kind of provides some rationality and practical advice. But many male clients that I see in my practice will very often share with me their feelings of helplessness because they don't know what that support looks like. And then what happens when the primary fertility issues with the man, such as with the man I talked about with cystic fibrosis, for him, it was an issue of, it was male factor infertility. And how does he deal with it? And even then, his ability to deal with the denial of the difficulty that he's having processing it can be very, very powerful. So the man in the couple is also experiencing his own issues of loss and helplessness. So being able to support his own needs and on top of that support his partner's need can become really, really challenging expectations from himself as well as his partner. And because of there is typically an absence of a forum to discuss infertility in general, and there's a lack of opportunity for men specifically to discuss their feelings. So once again, the man is also dealing with feelings of isolation. For him, it's also a companion in this journey. Additionally, fertility treatments or any kind of infertility diagnosis can put a serious damper on a couple's sex life. And I often see couples who find it very difficult to return to a normal sense of intimacy well after a number of cycles or as they go through the treatment process itself. So infertility puts a lot or a considerable amount of stress on even the most stable of relationships. I do have couples who will share with me that it's brought them closer, but there are sort of layers of things they've had to navigate. Typically have to navigate. So let's look at what are the sources of conflict for a lot of these couples going through it. Individually, if there is an identified issue that this is egg related or sperm related, there's disappointment with oneself. My body is not cooperating the way it's supposed to, or even when there's people who have health issues that they knew about, such as CF, or I work with patients who have had cancer in their childhood. So they knew they would have difficulties, but when they reach that stage in life where they are now about to start a family, those known issues take on a different meaning and different loss becomes evident, and disappointment with oneself. There's often a disappointment or viewing the partner with a sense of flaw by the partner with whom it's not the primary issue. And again, we don't kind of know how to navigate those feelings, and we feel awful for having those feelings. One of the biggest areas that I see where people run into difficulties or couples run into difficulties is we all have this assumption that if we're going through the same thing, our partner is feeling it the same way as I am, or feeling it at the same time. And often there's a tremendous amount of dissonance in what they're feeling and how they're feeling it, and they don't know how to address that or even recognize that. And there can be resentment. And again, the biggest thing is feeling like there's a lack of support from the other person. And when I talk about conflicting needs and desires, one of the things I see that's specifically related to infertility can include things like when to do a cycle. One person might feel ready and the other person doesn't. So those needs, fundamental practical needs, can be at odds. Another area is looking for support. Often the person with whom the medical issue might lie, if that's identified, they want privacy. They don't want to talk about it because they're having to process things that I talked about earlier, sort of body image issues, their sense of self. There's a lot of shame and flaw issues that come up. So they're not willing to discuss it openly, but the other person might need to look outside for getting some support, even if it's just a listening ear. So those things can also be in conflict, and how will a couple navigate that? So through all the emotional and procedural experience of treatment, while couples and individuals going through it, getting pregnant becomes kind of the holy grail, the most important life goal. And so the issues around fertility take on tremendous weight and often can swallow individuals and relationships up. Basically, the couple is living under the umbrella of infertility. It has been reported, there have been studies done that show that fertility patients are second only to terminal patients in their willingness to tolerate any kind of treatment, because it is all about hope. And life then becomes a tremendous and tenuous balancing act of getting your hopes up and balancing that with fear of the outcome or the process. For anybody that's gone through any kind of fertility treatments, the cycles are not in any way easy or fun. And as I said before, the fact that nothing comes with a guarantee around this instills a tremendous amount of fear. You're going to be turning over your life to something that doesn't necessarily have the desired outcome. Any other area in our life, sometimes, most, not any. If we want D, we do A, B, C, and we get to D. With fertility treatments, we can do A, B, C, and get X. So after a while, people kind of know that. And the first treatment can be entered into very differently because you're basically turning it over to science, so it should work. So when it doesn't work, subsequent treatments can take on sort of added dread and fear. So once we acknowledge that the medical interventions are really, really frightening and uncertain and difficult, the anxiety is also easy to understand. And how do we deal with it? So there are ways we have to find to gain control in a situation that we don't have a lot of control in. One thing that I really, really stress with any couple going through it is to always remind themselves that infertility is something that affects them, no matter with whom the issue resides, them, the couple, and not just the person with whom any medical problem, including cystic fibrosis, as a health issue. And both of you are being affected, and both of you are under stress and distressed. So always to bring it back that this is your journey together, as cliche as that might sound. So The coping strategies that, they're of course very broad here. I'm going to talk about men and women going through infertility treatments need to learn ways to take charge or control of the things that they can control. And what would they be? Sometimes it is just recognizing their individual feelings. Sounds like stating the obvious, but this is often a real challenge because it's scary to do so. The feeling of despair or helplessness, most of us don't want to acknowledge them, but you can't manage your expectations if you are, somehow unable to label or identify what you're feeling. Learning ways to express emotions in direct but appropriate ways. Anger is a very common feeling for people dealing with fertility, but how to deal with anger or how to express them are not things we are often taught or feel comfortable with. But if you don't find a way to express them, it's just going to go underground and it's going to cause other issues. So learning appropriate ways to express those feelings amongst yourselves is really important. And one of the biggest things is, being compassionate with yourself as you go through this, because basically you're dealing with a very unfair situation. I don't think there's anything fair about anybody dealing with a very, very serious health issue that affects their daily life, or on top of that, dealing with fertility when you're ready and willing to start your family. So the feelings of depression, anxiety, helplessness are pretty much universal for anybody going through any kind of infertility. One of the things that I make a point of stressing is this message of being positive, or to remove the message. It can be coming from internally within us, or that's the message we get from everybody else. Be positive. Anytime we learn it or run into difficulties, that's kind of what the message is generally. Just be positive, think positive. But I don't think there's anything positive or being positive and going through infertility and fertility treatments, to me, is a bit of an oxymoron. So I see women particularly putting a lot of pressure on them after a failed cycle, kind of saying things like, I wasn't positive enough, general message. And I don't think that is helpful. It just piles the plate of one more thing they have to deal with, or they have to second guess themselves about. So acknowledging and removing that pressure and being positive versus being realistic, and having a belief when you do cycle, sort of learning how to do that, I think is really, really important. The tools, of course, there's professional support, counseling, any of the local clinics, but I think pretty much any fertility clinics has or offers counseling. And there's a reason for that. It is not an easy process to navigate. And counseling does help. And often people, when they first start treatment, don't take advantage of it, because most of us are able to run our lives very well and we don't necessarily need outside help. But by the time they have done second, third, fourth cycles, there's sort of a compound effect on the person going through the treatments and on the couple. So I very often see individuals, and actually I only see the husbands in my private practice. I will very often see couples in session, and I'm making that distinction because the other thing I run is a couple of support groups at the clinics, but those are mostly for women. And the main reason that's structured that way is because, as I said, it's us as women who go through the treatment. So the feelings of isolation become quite crazy making. So the most valuable part of a well-run support group is kind of having a place to express some of those feelings, but also meeting other people who are mirroring or very closely mirroring some of the same feelings you have. So not feeling alone is one of the biggest parts of, or the benefits of attending support groups. And on top of that, holistic approaches, anybody that I work, or most people I work with, are usually also doing acupuncture, massage, traditional Chinese therapies, and all of those are good. Just manage your expectation in terms of what you can expect from the different ones. If somebody promises you things that are unrealistic, like do this many sessions of acupuncture or take this herb, I can guarantee you'll get pregnant, I would probably walk away, because the chances are that's not going to happen. So manage your expectations. But if those are the ways that you take self-care, that's really, really important to do through this process. I talk in terms of relaxation and breathing techniques. The breathing, again, may seem very self-evident, but partly because it becomes a fight or flight. You're living with this anxiety, which also will manifest in physical symptoms of tightness in chest and panic attacks. So learning how to help yourself through those would be beneficial. Meditation can help. Journaling. My main reason for asking people to do that sometimes is just to get the thoughts out, but also if you have it in black and white and you end up doing multiple cycles, because it can be a long journey, you have a way to measure, was the duration less? Am I feeling the same thing this time around as I did last time? Those kinds of things, and just getting it out of your head. And basically giving yourself permission to feel your feelings. For couples, things that I would look at would be, one of the things I often ask them to do is to schedule a time to talk about the fertility issues. What ends up happening is, typically for one person, it's something that they don't stop thinking about. For another person, it's not something they're thinking about. So one person wants to talk about it all the time, and it can lead to conflict or just unhelpful or ineffective. So if I suggest that, maybe pick a day when you're not working and you have 15 to 20 minutes maximum, and it's your time to hear the other person and be heard, not necessarily to fix anything. So that if you have things that are bubbling up for you on Tuesday, but you know that on Saturday you'll have those half an hour to discuss it, it might make it manageable to get through the next few days. Because often people will say, we talk about it, and every time we do it, gets to, we have a conflict, or we end up getting nowhere. The other thing is to learn and acknowledge or allow, for difference, and accept that there is no one way to feel or one right answer. So learning effective communication is, of course, a task in any relationship, but definitely while a relationship is going through fertility issues, it would be really, really important. And to learn your own emotional triggers and patterns, and also the other person's, and then you can help manage and navigate those for yourselves better. There are tools that are available, worksheets for anxiety monitoring, bodily sensations, worry diaries, things like that. And I've just put the link there. You can go in and look at them and print out whatever you might think is helpful. Definitely, if you're seeing somebody for counseling, that would be something, if you were seeing me, I would walk you through and do with you. So in summary, I basically hopefully looked at why crisis, looking at infertility as a crisis in life makes it easier to understand why it's difficult, sort of the unique hurdles of infertility for someone who's additionally dealing with health issues such as cystic fibrosis, understanding that the roller coaster of emotions are very common and difficult to navigate. Infertility and how it affects the person going through treatment, how it affects the partner, and then the couple, the impact on the relationship, and the differing reactions that each of us might have. And hopefully I've given you some coping skills or coping mechanisms and tools. And thank you very much for allowing me to have this time with you. I hope this was helpful.
Thank you so much, Chandra. That was such a fantastic presentation. I think navigating the emotional aspects of a fertility journey can be just incredibly difficult. So thank you so much for providing your expertise and knowledge on this topic. I think it's been really helpful and really valuable information. So thank you so much.
Thank you for having me. I appreciate it.
At this time, we're going to hear from Jason Chartrand for his patient experience before taking a few questions. Jason is an adult living with cystic fibrosis that was diagnosed at the age of 15 years old. He lives in Ottawa with his wife, Chantel, and his 4-year-old daughter, Adele. They are expecting their second child, a boy, at the end of May, so congratulations. Jason is also an online personal trainer who helps moms on mat leave get stronger and energized so they can confidently tackle daily tasks and go to work feeling awesome. Jason was kind enough to meet with the chair of our Adult CF Advisory Committee, Megan Parker, to pre-record a video of him sharing his experience for us today. So we'll now listen in to what Jason had to say before we take questions.
So I guess I'll go over my story, I guess. So I found out I was infertile, I think in my 20s, even before I met my wife. So I had the test done, and then they confirmed like 95% of CF male patients that they don't have the vas deferens, so the device that brings the semen to outside the body. So I found out that in my 20s, I believe. I forget when the test was actually done. So, and then when I met my wife, and then we decided to having the discussion about children, we were just weighing the options. Do we go down having our own children? And I explained I can't have them in the traditional sense, or if we should go down the adoption type road. So we came to the conclusion of unless we wanted to have our own kids. So then we went to the fertility clinic in Ottawa, which they were great. So, and they've dealt with a lot of CF patients before. So, and that kind of reassured us, like, yes, we've done IVF on CF people before with great success. So then they laid out like the path, like what were the options for us in IVF. And before even starting down that path, my wife got genetic testing done just to make sure that she wasn't a carrier of the CF gene, just to give us a peace of mind, like if we don't go down that path, we wouldn't likely have a child with CF. So once that genetic testing came back, that she wasn't a carrier of the CF gene, then we decided to go down the road of IVF. So after we made that decision, so like I said, the IVF doctors laid out the path. So it was a full cycle of IVF. So the issues only came from my end, and my wife did some tests and blood work. I actually forget, it was so long ago what she actually had to go through, but yeah, the issue was on my end, so we know exactly what to do. So from a male perspective, they have to go in and retrieve this semen to be able to fertilize her eggs in like see a petri dish and to make valid embryos. So we had to go down that path. There was a procedure I had to go through. It was okay. It was a day surgery. It wasn't anything that bad. You just needed like a bag of peas to recover correctly, where they made the incision to get the semen out. And then we went down a full cycle of IVF with my wife. So I think the hardest part with my wife was the injections she had to perform to produce follicles and then proper size follicles to be able to inseminate outside of the embryos. I'm not sure if I'm using the right terms here, but basically what they had to do is get my stuff, get her eggs, put them together in a dish, and then inseminate her. So that was the process of how we did it. So we were really fortunate because the first embryo we tried, we were successful. So my wife was pregnant and she delivered a healthy baby girl in February of 2016. And I guess an overall question or worry about it overall, the whole span is the biggest worry was, will it work? Like we both wanted to have kids. We made the procedure wasn't covered by the government yet, so we had to pay out of pocket. So we were fortunate enough to save some money for that. So it was a financial thing. It was also a decision. The genetic testing was kind of a worry. Then the financial thing was a bit of a worry, but not so much in the end. And also, will it be successful? So all that was kind of in the background, just playing with our minds. It was always a constant stressor. And then when you become a parent, it's another ball of wax of worries. So so I guess the question you wanted to answer is like, how did we cope? I think we just, we talked to each other, but I think one thing I would have done in retrospect was maybe talk to more people who've gone through the process, or talk to like a social worker or a therapist, just to go through things. Coping, yeah. So advice I'd have for people that are going through this, we were very lucky ourselves. So I would talk to a lot more people who've gone through these types of things, who've gone through an IVF cycle, what to expect, what can you expect. The doctors were very good at setting our expectation on what the likelihood of getting pregnant was, the likelihood of not getting pregnant was, the likelihood of twins. They're very good at that. And then they were very good at explaining the whole process to us. So they were good in that sense, but I would have liked to have talked to somebody, either, a social worker, a therapist, and more people that have gone through, just to be able to have those conversations. And I think that would have been helpful for us, but we managed. And then to continue the story, so through that first cycle of IVF, we had 3 embryos that one was used to make her daughter, and the other 2 were frozen. So then I think when our daughter was 2.5, 3 years old, we made the decision to try to have another child. So in December 2018, or before then, we went back to the Ottawa Fertility Clinic. We said we're interested in unthawing those 2 embryos and then trying again to have another baby. So in December 2018, we were ready to go. We had an appointment set up to go through the process again. Chantal, my wife, had an appointment to get inseminated with one of those valid embryos. And unfortunately, those 2 embryos did not survive the thaw, which we knew there was a chance, but there was I think an 88% chance of one embryo not surviving, but two, no, sorry, there was a chance, the chance of survival was 88%. And then losing both embryos was kind of, I think it was like a 1%. I think we did the math and it was like a 1% chance of happening or something like that. So unfortunately, we didn't, we weren't able to try again. And that was, I think, the hardest part for us, because everything had went so well, and then this happened and we're like, oh, okay, so maybe it wasn't meant to be. But I think in the province of Ontario, I think the federal government, the provincial government decided to fund one cycle of IVF treatment. So that before December 2018, in July 2018, we signed up for that list, just in case that something would have gone wrong with the two embryos that we had. So, so in July 2018, we went on the waiting list. So we had to wait until July of 2019 to restart the whole IVF process again after the loss of those two embryos. So, so we went through the whole cycle again. They already had my semen from the first time because we kept paying for the freezing fees. So, but my wife had to go through another cycle of injections and more thorough injections or more injections because she was over 35. She's 38 now. So I think in August, September, we were able to restart that process of injections and stuff like that. So then we went through that cycle, and I think we came out of it with I think 5 embryos, and we decided to place one because over 35, I think you can only put in one. So, and then in September of this year, we found out she was pregnant again on the first try of this cycle. So she's pregnant, she's due in May, and we're thrilled. So we're really happy about that. So our biggest challenge was losing those 2 frozen embryos a few years ago. So so that's our story. I mentioned like people wanting to do this. It can be tough, especially emotionally and psychologically. It can be a really rough go. And it just, you know, I think like I said before, I would really look for somebody to talk to as you go through the steps, because most of this stuff you can't really control. You can't really control if your wife's going to get pregnant or you're going to get pregnant. So it's kind of out of your hands in some sense. But you can talk to somebody about it. Your partner or a professional would be my biggest piece of advice. And the doctors at that fertility clinic here in Ottawa they're really great at just laying out the process, your odds of having a child, your odds of twins, and all of that. So just looking over my notes here. Oh, the other stressful thing is like when my wife got inseminated with the embryo, you have to wait 2 weeks before you find out like that she was actually pregnant or not. So that's a 2 weeks that can be very long. So you just have to see, or you can't think about it all the time. So that's another like emotional hurdle you have to get over because it can be a long 2 weeks. So that's our story. I mean, I don't know if you have any questions, follow-up questions, or
that was really great. Thank you, Jason. Sounds like some of the biggest things that that you mentioned was that like stress is just embedded within this whole thing.
yeah,
And there's kind of different, I don't know, levels of stress for the different periods that you have to go through.
yeah.
And that's kind of like a common theme, right? Is that this is a very stressful thing, and there's a lot that's out of your control. And so it sounds like some of the things that you did was kind of keeping busy. What else did you do kind of during some of those like more stressful periods?
It's a good question. Like, I wish we would have had somebody, like a professional, to talk to. Like, I think the first time was just a lot of, like, we consulted doctors. My wife was really good at asking questions about what was next, what was the next step in the process, and try not to think about it too much. I mean, the first procedure, we were both working, so if you can, like, we worked, just our daily jobs, and just tried to focus on that, and try not to think too much of it. I tried to, like, not talk about it too much, like, just in the sense of, like, not planning ahead more than, like, talking about, names and cribs and all that stuff, or having a baby room. Like, I was really, like, apprehensive of talking about that stuff, feeling like I would, like, jinx the whole process. So I was more like that. My wife was more like, she, she was more optimistic that it would work, and it did work in the end. So I had a pessimistic view of, like, oh, I won't, the chances are low. They're lower of not working than working. So it was, yeah, that was hard. It's just like, I try not to set my expectations too high. To be able, oh, this is a for sure thing that will happen for us. It's just like, yeah, maybe it's, not for us, and and then if it happens, that it's awesome, and then if not, then we'll find something else, or try other options, or
Yeah, so for you, it's kind of like you needed to stay grounded in the present and not really think too far ahead or get ahead of yourself. You kind of just needed to go through each step at a time.
Yeah, exactly. I was just like, okay, well, next thing. And then when she did get pregnant, it was still the same theme, like, just like, even though, like, it was successful, like, okay, well, then you're worried about all the things that could happen during a pregnancy, and I'm not even the one who's pregnant, right? Like, she has to do all the hard work, and so for me, it was just trying to, like, just keep things present, not too much about what's going to happen.
So if you had, like, your biggest, I don't know, like, one or two pieces of advice for somebody thinking about going through this, what would that be?
I repeated this often, but I think I would both talk to your the fertility clinic, if you choose to go down that road. Just talk to them. Here, they were very good at just laying out, answering all of our questions, giving you realistic expectations of what can happen. They knew, like, the issue was on my end, so and she did testing, and she cleared all those tests. So just make sure you know all the steps that are going to happen. And then the other thing is, like, if you're having a hard time dealing with that stuff, or stress, or just like stressing out about stuff you can't control, then I would talk to a social worker. So now in Ottawa, we have access to social workers as part of our CF clinic. So that's a service they offer. And I'm not sure like, everybody's situation is different in their clinics. So we have that access. So it's free of charge. So I would kind of take advantage of that, or see a therapist just on your own, or as a couple, or each have their own therapist if you have if that's available to you.
Yeah. So basically just take advantage of the supports that you have,
Yeah.
whether that's through like the CF clinic or the fertility clinic, or
Yeah.
or kind of a different route as well, but take advantage of it.
Yeah, absolutely. Like, in the end, you can't really control this stuff. So it's just like, if you need somebody to talk to, they're very good at putting things in perspective and, reframing things, saying like, it's unfortunately out of your control, and you just have to hope for the best. Yeah.
Awesome.
Yeah.
Anything else to add, or I mean, you did a great job.
Well, thanks. I wasn't really prepared. Oh, and just make sure, like, if your province funds it, just go on the list. Get on the waiting list if it's available to you. If not, we saved some money up to fertility. It's not cheap. So make sure you're set financially as well, which is weird to say when you have a child, but it's something, the procedure is not cheap. And then once they reach daycare, it's not cheap either, right? So it's make sure you're set financially.
Yeah. No, that's a really good point. Like, it's not even just emotional stress, right? There's financial stress when you have to go through fertility treatments, and that's a big deal. Yeah,
absolutely. And make sure you're ready to have a child, because it has an impact on your relationship. It just changes everything, and the family dynamic changes. So make sure you're ready. Make sure financially and with your partner. Just make sure you're ready. It's a big lifestyle change.
Yeah.
So yeah.
Anything else to add, or I mean, you did a great job.
Well, thanks. I wasn't really prepared. Oh, and just make sure, like, if your province funds it, just go on the list. Get on the waiting list if it's available to you. If not, we saved some money up to fertility. It's not cheap. So make sure you're set financially as well, which is weird to say when you have a child, but it's something, the procedure is not cheap. And then once they reach daycare, it's not cheap either, right? So it's make sure you're set financially.
Yeah. No, that's a really good point. Like, it's not even just emotional stress, right? There's financial stress when you have to go through fertility treatments, and that's a big deal. Yeah,
absolutely. And make sure you're ready to have a child, because it has an impact on your relationship. It just changes everything, and the family dynamic changes. So make sure you're ready. Make sure financially and with your partner. Just make sure you're ready. If people have questions, I can always you can add me on Facebook, and I can always chat with them as well.
Perfect. No, that's very helpful. Thanks, Jason.
Thank you.
Okay, so I do just want to thank Jason for sharing his experience with us today. That was really interesting, hearing the patient's perspective, so thank you. We'll now, I am mindful of the time. We're running over a little bit, but I would like to give the opportunity for people to pose any questions if they would like. Thank you for those who have already sent their questions in. If you do have some additional questions for Chandra, then you can use the WebEx chat box to submit your questions now, and then I can read them aloud for Chandra to answer. I'm not seeing any pop up on the chat box yet, but maybe just quickly, Chandra, maybe you can address one question that was, I think you did cover most of the questions that were posed already in your presentation, but just wondering what are some concrete ways for how to start telling trusted family or friends about your struggles with infertility?
Yes, you mean as you're going through it, like how to discuss it with family and friends?
Yeah, I think so. Yeah.
Sure. I think there isn't a singular answer. I think there are people who, especially I work a lot with people doing third party, which is egg donation, sperm donation, surrogacy. And then as Jason talked about, there are people who do IVF, possibly using their own genetic material. I had a bit of a hard time hearing some of Jason's audio, so I hope I'm not misrepresenting what he said. So depending on which one you're doing, I think people can, I don't think there's one way to do it. I think sometimes with third party, people don't want to share that until such time that they know they will be sharing it with their child. So if they share it with their families, then that option might be taken away. But I think just to let families know that we're struggling, and then also maybe setting some clear expectations of how they want them to check on them. I often hear, I don't want my mom to phone me every day to see how I'm doing or what's going on, because that becomes quite onerous. So setting boundaries when sharing it with family, just that we're having some fertility issues, we're looking into doing treatments, and I'll let you know when there's something to share, or maybe I'd like you to ask me once in a while, kind of setting clearer boundaries. And again, that's easier for me to say globally, but I think people couple that out as they go through it. Initially, they may not know that they don't want phone calls every day, or they will be hurt if their mother-in-law doesn't ask them after they mention it. So I think it's very individual, but just kind of getting clearer as the process goes on what they need would be helpful. Does that answer your question?
Yeah, I think that's great. Thank you. I don't see any other questions that have popped up in the chat box. And I do think that you and Jason covered a lot of the questions that were posed within the presentation, the importance of self-care, coping strategies.
If I can just, as I was listening to Jason, for the patient's perspective, he kind of confirmed, and I got the feeling that it would have helped him and his wife to have had, or maybe individually, just to have someone to talk to process what they were going through. And as I said in my talk, that often people don't recognize it at the beginning of their journey, but in hindsight, you kind of feel quite emotionally drained, I think he talked about. And the loss of control that I had mentioned. And it was interesting when he mentioned the 10 days to 2-week waiting period. I'll often see patients at that time because that is a very difficult period of time that comes up often, just that waiting to find out, especially for people who have done more than one cycle that didn't work out. So he just kind of confirmed some of the things that I hear from my clients as well.
Yeah, for sure. I remember that being a really, really tough time as well. Mm-hmm. That's a really good point. I know I really relied on counseling throughout our infertility journey as well. So yeah. Mm-hmm. I think given the time, we'll wrap things up. Chandra, did you want to add anything in closing or?
No, I didn't include specific resources. Jason was talking about what's available in Ontario and sort of the free cycles. A lot of those things are different now from when he did it in 2016, possibly different Health Canada acts have come down. So people should really make sure that they check those out. Yeah, because it's not necessarily uniform. and it is private. The fertility clinics are private funding, so it's not covered here, just so you know that.
Right.
Thank you for allowing this, and people can always contact me. I think on my thing, I put my email address up there, so if there are questions or anything, I will do my best, or through your the CF site.
That's great. Thank you so much, Chandra. I do want to thank Chandra and Jason once again for making the time to speak to us on fertility and family planning for people living with cystic fibrosis. I know everyone is so busy. Chandra, I know you're probably busier now than ever given the current pandemic. So I really thank you so much.
Yeah, because all the clinics have had to shut down, and people are sort of abruptly have had to stop their cycles and stuff. So it's a difficult time for everybody, and definitely people going through fertility treatments. And once again, things are out of their control. This is sort of a very global experience that we're all having right now.
For sure.
Thanks very much for having me. I appreciate it very much for an opportunity to talk.
Yes, thank you so much for joining us and for your presentation. And thank you everybody for tuning in today. As always, this webinar was recorded and will be made available for future viewing. If you do have any questions, you can direct them to advocacy@cysticfibrosis.ca. And stay safe, everybody, and thanks again so much.